Alrighty, I think we can go ahead and get started. Welcome everyone, good afternoon. My name is Megan King. I am one of the public health educators at the Washington Poison Center. We are so excited to have you join us this afternoon. If you've been following us on social media, you know that this is National Poison Prevention Week. So we've been participating in a lot of national events and national postings on poison prevention, but this live stream is the kickoff to some of our local events we're having. So we are so thankful for Dr. Scott Phillips, who is our new Interim Medical Director. He is sharing some of his very precious time with us this afternoon to give us a little bit of an introduction to himself, share some of his background, and to give you the opportunity to ask him any questions that you might have. So welcome, Dr. Phillips. Thank you for coming today.
Well, thank you. It's great to be here.
So we have some questions for you, but for folks who are listening in, please feel free to type any questions into the comment boxes on YouTube, on Facebook. We will see those and we're happy to share those with Dr. Phillips. But first, let's just go ahead and get started with some of your background. So you are a medical toxicologist. Do you want to explain to people what that means, how you got on that path, what your background is?
Sure. So first of all, a medical toxicologist is a doctor that specializes in the diagnosis and treatment of people that have been poisoned from whatever cause, whether that's a medication, a plant, a snake bite, all those types of things. It's a pretty big area. So many people have never heard of a doctor that specializes in treating poisons, but that's in fact what the medical directors of poison centers do. This is our specialty, and we look at taking care of these types of patients. So I got into it, maybe 30 years ago, I guess at this point. I completed an internal medicine training, and that's especially a medicine where you deal with adult illnesses. And so I did that, and then worked a couple of years in emergency department, saving up some money. And then I did my toxicology specialty training in Denver, Colorado at the Rocky Mountain Poison Center. And then I remained on the faculty there, and I'm actually still in the faculty there for a number of decades now. So that's kind of my background, and ultimately I was born in Washington State and went to school here and found my way back here, partly to take care of my family and partly because it's a wonderful place to live.
So then how did you get started with the Washington Poison Center?
Well, I got started with the Washington Poison Center, I guess about 6 years ago, something about that time frame. And it was in between medical directors. At the time, there was a search going on, and they needed some help in backing up the poison center and supervising some more difficult cases. And I had some time, and I reached out and said, "Gee, I'm happy to help. If you need any help, let me know." And of course, it was a time when they needed a little help, so it worked out well. So I started then, and then became the associate medical director about 3 years ago now, and helping out with just the medical side of things. So that's really answering questions for the nurses and pharmacists in the call center, as well as helping Megan and Alex and Jared in the public health outreach side, but mostly just focusing on medical things, talking to other doctors that may have cases that they have questions about, so we could help them. And so pretty involved in just the medical side of things. And then ultimately we came to another transition point where we needed another medical director. And so currently I'm filling in the vacancy of the medical director. And it's a fantastic place with a lot of fantastic people that do great work. So I'm excited to be back in Washington, and I'm excited to be here at the Poison Center in Washington.
Well, we are certainly excited to have you on board. So do you want to explain to people a little bit more about what your responsibilities are going to be as our interim medical director, where they might see you or hear from you?
Sure. So the medical director primarily is responsible for the call center. Our call center is who you call if you have a poisoning question, and that can be the public. It can be doctors, nurses, or other healthcare practitioners from a hospital, a clinic, an office. Um, so we help support the nurses and pharmacists that take those phone calls, those toll-free phone calls for help. And oftentimes, the medical director, I also am on call to answer questions from other healthcare providers if they have very, serious cases that are difficult to manage. We help them over the phone to try to get a good outcome with those types of patients. Also, we work to create guidelines to keep things more uniform in our treatment of patients and get sort of evidence-based care for a lot of these cases. And we do a lot of quality assurance and investigations into our calls and our cases to make sure that we're doing the very best job we can for the public and for ourselves. So it's a pretty broad hat to wear, and there's lots of other little small areas that I'm responsible for as well. But primarily, it's to provide the medical backup to the poison center.
Great. Thank you for that breakdown. It is certainly a huge role encompassing a lot of different things. So you've been with the Poison Center for a few years now. Has anything changed in your time that you've been here?
That's a great question, and I think poisonings have changed just in the last few years, but it's been really a dramatic shift in the last 30 years that I've been involved in doing toxicology. Um, and I think the big shift is that we're seeing uh, a lot more potent ingestions or exposures that people may have. And our cases are actually much more critical. So the patients can be very, very sick. We still see a lot of, calls with patients that aren't real sick, and we can provide some great advice to parents and families and caregivers on who can stay at home and who needs to come to the hospital. But overall, I would say that our knowledge of the actual mechanism of action of a lot of substances has grown tremendously and has the potency of many of the things that we see. So, boy, our call center staff is just dealing with some really, really sick patients, and a lot of the phone calls are taking longer and longer. And I think that's the big difference now. So, more drugs of abuse, more that are more potent, more chemical exposures that we might see, particularly with very serious types of things. So, I think the severity is really the thing been um, that's highlighted the most to me. And then, of course, our way of dealing with that and learning and research into it has expanded tremendously, which has been just great.
So I know it's probably a little too soon to talk about many trends, but what about even just in the last year with the COVID-19 pandemic, since that's changed all of our lives so much?
Yeah, it has, and there's some really interesting trends with COVID that we've seen, not just from the COVID complications, but a lot of exposures that people have. Of course, you may or may not have heard about a lot of hand sanitizer exposures that we've had with the alcohol hand rubs. We've seen a lot of poisonings with that. But we've also seen a lot more poisoning with drugs of abuse and alcohol. That's gone up significantly, probably because of a lot of the anxiety associated with COVID and people being isolated and alone and unable to socialize. And it's created a lot of anxiety. And so it's really created a big uptick in a lot of our cases. And that includes everything from the hand sanitizers that I mentioned to opiates and alcohol. So a lot of things are really going up because of this isolation.
And for all of you who are listening, if you're interested in seeing some of the trends that we have been looking at, like hand sanitizer and some of those drugs of abuse, we do have data snapshots that are on our website, which we can pop into the comments. Oh, and it's right there on the screen as well. So you're welcome to go check those out too. So a little shift in topic here, since you've been with the Rocky Mountain Poison Center for a while and Washington Poison Center. What's your favorite part about working in a poison center setting?
Well, I think I really enjoy working with the staff. It's people that love to come to work every day. It's people that are fascinated, like I am, with a job that has new questions and is different every single day. We get new and unique cases every day, and it keeps the job fascinating and interesting. And we have a great collegial relationship, not just within our own great Washington Poison Center, but also between poison centers and between all of our poisoning specialists. It's really a great experience and a great group to work with.
Well, we certainly all enjoy working with them as well as the public health educators. We are always learning something new from everyone. So maybe a little along the lines of what you enjoy about working in the poison center setting, do you have maybe your most interesting case or your most challenging case you've encountered that you want to share?
Well, I guess that there's been so many challenging cases over the year, and it's almost on a daily basis that we see cases that just, make you scratch your head. For example, last night even we had a very interesting case of a person who is an opiate abuser long term and was trying to supplement and try to get off of the opiates by taking a plant. And I'll leave the name of the plant out for safety reasons. But this patient came in to the hospital and was having tremendous cardiac problems and had to have their heart shocked multiple times and was on a lot of different medications trying to manage that. And it's a little unusual for these types of exposures to occur, but there's really something new and unique every day. And that's what makes this specialty so interesting and makes you just want to go to work every day. It's terrific.
Thank you for sharing that. So we just have a couple minutes left, so I think I'll end with one last question to just ask if you have any important messages you want listeners to take away about poison centers. Any final thoughts you want to share?
Sure. Well, I think the important thing that I want listeners to take away is that everything that you can come in contact with in our world around us is made of chemicals, and good and bad. These chemicals can be harmful, whether it's air or water or pills or plants, at some amount that you might take. So the more you would take of something, potentially the more harmful it could be. And so please pay attention to safety measures with medications and keeping them locked and out of reach of young children. Please pay attention to those kind of medications. And if you have any questions whatsoever about your medications, your plants, your mushrooms that may be growing in your yard, please call us at the Poison Center. We're more than happy to help you. We're more than happy to provide information. And this is all free information to the public. We do all of this for free. You can get consultations with toxicology professionals like myself and several other medical toxicology doctors that are on staff with us at the Poison Center. And these are all free consultations. So please call if our staff can help you. We'd encourage that, and be careful out there.
Perfect way to end things, Dr. Phillips. Thank you. Just a reminder to folks, that phone number is posted on your screen. If you don't already have it saved into your phone, we encourage you to do so right now. And remember, you can always call and ask questions. It does not have to be a poison emergency. So in these last couple seconds, if you have any questions, please feel free to put them in the comment box. Otherwise, thank you so much, Dr. Phillips, for sharing some of your time with us and answering our questions. And we look forward so much to working with you in the months to come.
Oh, thank you. I'm happy to be here and happy to help. I love our staff and I love our poison center. So we do a great job for the public.
All right, thank you. I think we can probably go ahead and end this stream. Please, anyone who's listening, feel free to reach out if you have any additional questions, and have a wonderful rest of your afternoon.